In 2012, 55-year-old David Alpern was diagnosed with throat cancer. Until coming here to UCLA, the proposed treatment options from his other doctors seemed worse than the diagnosis.
He described a procedure where your face is split in half and they go in and it's basically reconstructive surgery, and I kind of tuned out at that point.
A right-sided throat tumor right at the level of his tonsil.
But all of his fears subsided after meeting with Dr. A.B. Mendelsohn at UCLA. The head and neck surgeon determined that David was the perfect candidate for a surgical procedure called transoral robotic surgery, or TORS. For the first time, this groundbreaking advancement to TORS, made by Dr. Mendelsohn and his team, will allow patients like David to lead cancer-free lives.
Currently, we are being able to apply TORS in areas that were thought to be previously inoperable. The parapharyngeal space, which is a deep neck space hidden behind the jaw and require complex surgical approaches, can now be reached through the mouth. And so we're seeing that we can now adapt the robotic system to many complex cases which we really didn't have good surgical options for.
With Dr. Mendelsohn at the controls about 50 feet away, the endoscopic camera and other robotically controlled instruments are guided directly through the mouth. Under careful guidance of the surgeon, the robotic arm moves precisely to the region of the tumor. The robotically controlled instruments are able to precisely take out only what is absolutely necessary, removing the tumor but leaving vital nerves, organs, and tissues untouched. No chemotherapy or radiation is required. After removal of the tumor, the throat is stitched up from the interior with no external skin incisions visible.
The surgical approach for tumors of the tongue and tonsil were so complicated in the past that many patients actually prefer not to have surgery at all, choosing instead radiation and chemotherapy. So I think the next step is really having patients understand that this is a viable option. I find that a lot of patients come in to see me surprised that this is even available to them.
As with many recent successful TORS procedures performed by Dr. Mendelsohn on over 100 other patients, David's throat cancer was completely removed.
So I try not to get too cocky or too excited that I quote-unquote beat cancer, but I think I did. And my hopes are just to watch my kids grow up and join my family and continue to enjoy life, because there's no side effects at this point.